So a lot of my patients want to know why I'm taking their pulse and why I'm taking their pulse so long. In Chinese medicine, pulse taking is a big part of how I actually diagnose what's going on in the body. So I have the intake, the questions that I ask you, and I also take the pulse and I look at the tongue. And that's going to be generally across the board what happens when you see a Chinese medicine practitioner. So I put all of that information together to come up with the diagnosis. And then when I have my diagnosis, that's how I choose my points, which meridians I'm working with, as well as the herbs that I might use as well. So how does pulse diagnosis work? Well, on the right wrist, I can feel the state of the lung, the spleen, and the kidney. And on the left side, I can feel the heart, the liver, and also the kidney. The reason there's two kidney pulses is that kidneys are the root of yin and yang in Chinese medicine. So there's a kidney yin pulse and there's a kidney yang pulse. So for instance, I'll give you an example. If a woman comes in having hot flashes and night sweats, and she has a weak kidney yin pulse, those things check out. So then my diagnosis would be kidney yin deficiency, and I would choose points and herbs that correlate with kidney yin deficiency. If someone comes in with chronic low back ache and weakness of their knees, achy knees, and maybe a little urinary incontinence, and they have a weak kidney yang pulse, that would check out for the diagnosis to be kidney yang deficiency, and therefore I would choose points and herbs that increase kidney yang energy. There's also different levels of the pulse. So there's superficial, moderate, deep level that correlate with the different levels of qi in the body, how internal a pathogen is. And there's also different qualities of the pulse. So say the pulse feels really tight, like a guitar string, that leads me to believe that there's a lot of wound up energy in the body. The liver is responsible for the smooth flow of qi throughout the body. So if it's not flowing and it's all bound up, then I know I need to help relax the liver. There's points and herbs to help relax the liver. If the pulse feels like a slippery pearl is running through it, we say that there's excess dampness in the body, and so we use points and herbs that resolve dampness, depending on where it is and what's going on, what are the symptoms. So those are just a few examples of how I use the pulse to come up with my diagnosis and how that translates to your treatment, my treatment strategy. I hope that makes sense. If you have questions, I'd love to hear them. Comment below, and I hope you have a good rest of your day.